Good morning, ladies and gentlemen. I am Dr. Richard Pereira, Coordinator, Health Outreach Project, and welcome to our session with none other than the Dr. Harish Shetty. We're going to be talking on strategies in coping with psychological issues during these very abysmal COVID times. Thank you all for joining in despite being a Sunday. But when you have a speaker like Dr. Harish, one cannot not tune in. I will tell you what the health outreach is all about later on in the session. But in a nutshell, the health outreach project through the Archdiocese of Bombay, that's the body under which all the churches of Bombay come under, provides reasonable and affordable healthcare facilities to the poorest of poor and migrants in the city of Mumbai across all communities. And we do this with the help of the local churches and volunteers there, but more about that later. Let's begin by inviting our bishop in charge of this project, Bishop Alvin, to start the session with an opening prayer, followed by Dr. Armida Fernandez, our project head, to introduce this session. Over to Bishop Alvin first.
In the name of the Father, and of the Son, and of the Holy Spirit. Amen.
Amen.
May God, who is the fountain of goodness, be with you all. God loves his creation, and his goodness sustains the universe. Let us pray now that he will bestow his blessings upon the speaker and upon all of us, so that we will be renewed and supported by his guidance. May Almighty God, you want us to increase your gifts and to return them to you and to our neighbor. Accept the offerings of our loving service. Let us pray. Blessed are you, O God, creator of the universe, who have made all things good. Grant that we may always use what you have created in your wisdom and with gratitude to you, and help us to share with those in need the gifts you have blessed us with. We make this prayer in your name. Amen.
Amen.
It is both a pleasure and an honor to welcome you this morning for this session organized by the Health Outreach Program. Like everybody knows, COVID has disrupted our lives, created so many issues and problems for every individual, not only in our country. We have enough problems, but across the world. And when it comes to health, it affects our physical health, it affects our mental health, it affects our spiritual health. And therefore, when it comes to physical health, somehow we know I've got a headache, I've got fever, I've got a sore throat, and the innumerable issues of health issues that we deal with, we recognize it and we go for help. We ring up a doctor, we go to the hospital if we can. So we're dealing with our physical health. But somehow when it comes to mental health, it is somewhere buried deep down. First of all, you think, no, there's no issue at all. Then we say that even if it is, we don't want to talk about it. We don't want to recognize and admit it. And therefore, these issues, mental health issues lie deep down and erupt, therefore, in some diseases that becomes a crisis and needs acute help. If you look at the COVID times, you'll see that not just the patients who suffered from COVID. Studies in the United States say 1 out of 5 patients who have suffered from COVID have a psychological problem. But not just the patients, but all those who look after the patients, their neighbors and people around, all of them, we all are suffering from some sort of a psychological problem, but we don't admit it. Let's look at one. Fear. I think there's not a person who's not really fearful at heart, deep down. They might not show it. Fear, will I get COVID? Will I need admission? And in today's day, will I get a bed for admission? Will I be hospitalized? What happen? I'll be by myself. What will happen later? So these are the fears that are building within us. And we don't want, if we don't talk about it, we don't try and, sort of look at how to deal with it, these fears then get into anxiety and anxiety disorders that would require formal treatment. The second thing is, I think that we have in these times, loneliness. We always said the senior citizens are lonely, their children are away. At least they had neighbors and friends and some relatives would visit. Now no one visits, but not just the senior citizens. It's everybody now. We are in the lockdown, locked in our houses. We are by ourselves. And this sort of a loneliness then goes into some sort of form of a depression. And if we don't know how to deal with this loneliness, then it results in depression that again needs. And this is so common. The stresses we face today, what stresses? We say we are homebound, you can work from home. But remember, working from home, you're doing your own work at home, you're doing the office work at home. And people around you, could be your spouse, could be your parents, could be your children. Look at the stress you're facing. And there is then anger, then there is frustration. And this increases, it results in violence, and the incidence of violence has increased in these days. So there are so many issues that we have to deal with, but we don't count. And today we are really fortunate to have one of the topmost psychiatrists, Dr. Harish Shetty, to speak to us. He's a brilliant speaker, you'll hear him soon, but I call him a social psychiatrist. I'm in the social field all my life, but he's a social psychiatrist. Wherever there is a crisis, could it be floods or wherever it is, earthquakes, he has been there. And we all reach out to him. And in this COVID times, there is not a place, he's with the government trying to help them, but also how many talks and panel discussions, maybe every day. I know after this, he has another session. He is there to reach out to people. So it is really an honor, a privilege, and a pleasure to welcome Dr. Harish Shetty, to welcome all of you who have joined in for this session. And I'm sure, and we look forward to the session. I now hand over this to Dr. Giselle, who will formally introduce Dr. Harish Shetty.
Thank you, Dr. Armida. Good morning to all of you present here today. The speaker today needs no introduction, and I have been given the honor and the pleasurable task of introducing him. Dr. Harish Shetty is a psychiatrist with extensive experience in the field of mental health, especially in connection with disasters. He has worked at Latur in 1992 to 1993 for a year, at Kandla after the cyclone for a year, evaluated the psychosocial processes at Jabalpur and Gujarat after the earthquake for a human rights group, and also worked at Gujarat after the last riots for 6 months. This was on the invitation of Amritaben Patel, then head of NDDB. He has also provided mental health intervention to seafarers after they are released from the clutches of Somalian pirates. He is a governing body member of the NTA, appointed by the Government of India. I now invite Dr. Shetty to enrich us with his valuable knowledge and experience.
Honorable Bishop Alvin De Silva, my colleague Armida Fernandez, Dr. Richard, Dr. Cedric, and everybody else. Let me tell you straight. If in your locality, if 100 families are randomly tested and they're all right, nothing wrong with them, you'll find at least 1/6 to 1/4 of them positive. So there's no worry. Why I'm saying this is because this virus is very mischievous. highly transmissible, but less virulent. Less virulent. And so the second wave will ebb shorter than the first wave. And that's the history. That's the history in the last epidemic. So first of all, nothing to worry. Fear is necessary to save yourself from danger. Anxiety is dangerous. Fear is normal. What does fear do? Fear tells us mask twice. Fear tells us wash our hands. Fear tells us if you can maintain a distance. So fear is a very adaptive response. It was adaptive in Stone Age when we had to take our bows and arrows to actually fight the animals. So fear is very, very important. And a lot of us are positive and we do not know whether we are positive or not. That's number one. Now, having said this, the second wave actually brings memories of the first wave. And memories are worse than reality. Memories are worse. And the memories are the Wuhan virus, the death in China, the deaths across the Western world and in India. And that makes the fear get converted to anxiety. I still remember a young boy calling me up. Doctor, I don't know why. I know there's an epidemic, but my parents are fighting with each other. And I don't know why they are fighting with each other. I tried to get them together. I tried to be the Mandolika Badsha, but then they actually pushed me away. And I told this young boy, just ask your mother and your father separately when they are in a mood to answer your question. You know, in life, you always have lucid periods. Periods when people are open to conversation, not people who are open to a monologue. And this boy said, I'm not a counselor. I said, in this era, young boys and girls are counselors of the parents because the simplest minds are the most profound. And this boy took his chance. First, he said, I'll take a chance with my mother, not with my father. Father Gabbar Asa. So he went to his mother and said, Mom, tell me, what is the one thing which is disturbing you? And she looked into the eyes, paused for a few seconds and said, you know, Puta, if something happens to me, how will you all live? If something happens to Dada, how will we all live? And that's the fear I have. And one of the most important and interesting things in this pandemic is fear does not get converted into anxiety, fear gets converted into irritability. And once she started sharing this boy hugged his mother and said, how Asani? I'm there for you. I'm there for you. And it's not that he's there for her, but the words which come, I'm there for you, is more powerful than the being, which means it's not essential to have everything along money, house, securities for the future. It is these three words, my huna, is more powerful than your assets. And when he said that, they just wept. And he sat down with her and he said, Dr. Shetty has asked me to do this because anxiety gets converted into irritability. And irritability can go down when just there's an expression of fear. They did that with the father and then they sat down talking to each other. But after some time, she said, mother said, don't act like a grandfather, be a son. So the point I want to make is, let's fight the irritability and anxiety inside the family by simple methods. Mental health science is not a rocket science. It's not philosophy either. It's mathematics, not close to quantum physics, but it's close to mathematics. You can do small things inside a house for yourself. You don't need a mental health counselor all the time. You don't need a psychiatrist all the time. So then as they sat down, the mother and the son asked the father, why are you worried and scared? What is it that really troubles you? And he said, I'm 49. I'm not sure about my job. Things are very fluid. And I feel if I lose my job, what will happen to me? What will happen to the family? And when the father shares his fears, the mind starts becoming creative. When the father states his fears, the mind gets blocked. When the father shouts his fears, the mind gets blocked. But when the father shares his fears, the mind gets creative. When the four of them sat down and started sharing 4 brains started finding answers to the problem on its own. Remember, the brain finds answers to the problem without you wanting to. And that's the secret. That's the first secret to be used inside your family around the time of COVID. And then they all started saying, don't, if you lose a job, we'll do something else. Because life does not exist in the visiting card. Visiting card, the designations can change, the addresses can change. The coronavirus, the small microprotein which is invisible, has brought us all to our feet. Intercontinental ballistic missiles makes no sense. Nuclear warheads make no sense. I landed my satellite on Mars makes no sense at all. It's humbled the entire earth. It's humbled the most powerful. It will humble Mr. Putin, who has extended his stay as the Prime Minister, President of USSR or Russia till 2036. So Corona said, boss, you are temporary travelers on the earth. Behave yourself. And that's what is the message of Corona. So this is one intervention. The second intervention, very interesting. One lady said, now we have all the time and now we are at home. Let's clean up the house. You know, sometimes this cleaning up the house is a very big obsession among men and women. And this woman saw the little dust on the fan and she brought a ladder and said, let me climb the ladder and clean the house, clean that dust on. And she fell down. Fell down. नीचे गिर गई और उसके बाद she started looking for an orthopedic surgeon. Difficult to get an orthopedic surgeon, difficult to get a hospital bed, difficult to get beds for non-COVID patients also. It's tough. But she found one, but she got her bone repaired, but she brought back the invisible virus home. So the second most important thing is, don't try anything difficult. The visible dust on the fan is not as dangerous as the invisible virus which you can get because of your act. Minimalism would mean eat less pizza, eat less burger, eat what you cook. If you can't get flesh and meat, please don't eat it. If you don't get fresh fish, don't eat it. But do not try heroic things inside the house just because you're free. You know what? COVID has taught us to have one more intervention, that is doing nothing. People are obsessed with doing something all the time. If they don't do anything, they feel very restless. I don't know why. They don't want to waste time at all. What the hell? Dr. Cheryl is smiling, but I don't want to waste my time. I have 15 minutes, I'll do this. I'll clean my cupboard. I've got 10 minutes. I think I did not clean that vase which is there on the top shelf. Shut up! Do nothing. Doing nothing is a beautiful exercise for those who have been doing everything across the life. So Corona said, do nothing, just sit down, laze, yeah. And in laze, what happens? Put your leg up, have a cup of coffee alone. Your mother-in-law will say, my God, what is happening to this lady? He's trying to sit on my head or what? No. Take my name. Don't take my name alone. I'm not as famous as Dr. Armida Fernandez. Take Armida Fernandez's name also. They both were in the morning on Ortho TV, and Dr. Ashok facilitated that. And they said, doing nothing is as important as doing something. And when you do nothing, all the old thoughts come. The day when you are married, all the good things come, the small things come. You'll get bad things also. Your father-in-law shouting at you, your father shouting at you, but just delete amnesia of the negatives and exaggerate the positives. And you'll get a lot of stories of your own life. And then share those little stories with your children. So that's the advantage of being at home, and that's the advantage of COVID. So the third intervention is very, very important inside the families. Suddenly parents find an opportunity to teach their children. My God, this 15-year-old called me, something is wrong with my parents' doc. I'd been to his school, so he has my number. And I said, what is wrong? My father was very good in physics. And he suddenly started saying, let me teach you physics. I have the chance. I want to make the best of the chance. The boy said, chill, man. Let me do it myself. And the father was upset. When he is willing to make his child घडवायचा जेव्हा त्याने प्रयत्न केलं, मी तुला घडवणार. At that time, this boy is saying no. And the father phoned up Well, the son gave the phone to the father, and father phoned up Dr. Shetty. Just tell him to sit down quietly. He's very bad in physics. I can cover that entire physics of 11th and 12th now when he's going to finish his 10th. We don't have all the answers, by the way. We psychiatrists don't have answers. We only pretend we have answers. We just do this and say, oh, really? Oh, really? We don't have all the answers. Ask Armida. We just pretend sometimes we have all the answers. We don't have all the answers. And then slowly, he was very, very upset, very discontented, and very sad that he cannot do. And I told him, suddenly you can't become that new father. You are the old father who has been busy earning for your family, which is also very good. I tell all the mothers, don't abuse your husbands in their absence and tell the kids, I'm taking care of you. He's in the office. He's in the office because he has to earn for you guys. He's not going and playing golf in the office. So all the women who tell the kids that I'm taking care of you, to na hanga, comes late. No, he goes out because he goes out for you guys. So don't do that. So he said, oh, Dr. Shetty, it's impossible. It's really impossible for me. And I don't know what to do. I said, first get baptized as a normal father. Then become the extraordinary father. He said, what to do? What should I do? And then I told him, stories are very powerful. When stories meet, there's a revolution. When stories meet, there's love. When stories meet, there's bonding. And I told him one thing. Don't start your stories of your courageous intervention in your family, of all the marks you have got. Don't share your glories, share your stories. Which means what? Which means just share with him your childhood. Simple things about your childhood. Not that I stood first, I stood second, I did this, I did that. No, not I. Talk about we. And in that we started talking about how his mother took him to school and all the small little things. And then when the stories he shared for the first time in his life with his child, the child opened his mouth, looked into his eyes and was listening to it. And then the child started sharing his stories of school. You know, Daddy, that day when I went to school, I actually did not go to school. We bunked school and we went for a movie. That day, the teacher was in the class. I had not done my homework. I was wandering around. I was hiding in the loo. And when these stories met, there was absolute joy. So all the anxiety of the virus can be neutralized by the joy of childhood. And then on one day, he sat with his father. Father, now teach me physics. And that's how it happens. So, my dear friends, little things can change your lives amidst the virus. We have faced such calamities again and again. We had the 1965 war. We had the 1947 partition. We had the 1971 war. And all of us, all the elders here, have come from far-off villages and landed in Bombay, and they've struggled. Ask your grandparents how they struggled. All these struggles were like the corona struggle itself. So remember, stories, not glories, inside the family. But you know what? Indians are all wired to give long lectures. Like all those guys on the TV who come on those other TVs, and they pause long and they start giving sermons. No, this generation does not listen to any sermons. They tell me, oh, you are born in 1958. What is my problem? I am born in 1995. What's my problem? So that is the second intervention. Third intervention is very important. Is in the last COVID episode, many of us may have had the virus infection. Many of us would have been hospitalized. Many of our family members would have been hospitalized. Many of us would have been on the ventilator and come out. Many of us would have been in the ICU. And there are a lot of stories like that. Remember, unfortunately, the government of India or the Maharashtra government has not done anything for mental relief. There are task forces for the physical body, as Armida said, but there are no task forces for the mind. And the mind and the body, they always talk to each other. They keep talking to each other. When the mind is healthy, the body is healthy. When the mind and the body have good conversations, then the system is healthy. But if you only focus on the body and saving lives and not focusing on the mind, you are preempting the next pandemic, the next mental pandemic, which will have a big burden of disease, which will be worse than the deaths which have occurred in the first and the second pandemic. So many of them who have come back after their infection would have symptoms like burning all over the body, Memories. I had a surgeon. He said, I still see all those guys on ventilators. When I was in ICU, I was only on oxygen. And they were all, and I can see, I can get those pictures in the night. My God, I still get the pictures, and I get up with a startle. This surgeon said, treat me somehow, doctor. I want to get back on my feet. I want to operate. And you know how doctors are? They are the worst patients. They never take any advice. And psychiatric advice, zero. Dr. Cheryl, Dr. All of you here, zero. Nothing happens. I told him, my dear guy, this is acute stress reaction, which means if the memories become hardened, you'll get post-traumatic stress disorder after a month. We need to loosen the memories, dissolve the memories, quarantine the memories, and get well fast. So what do I do? He asked me. I said, write down all the memories as it comes in great description. When you write in great description, the energy associated with memories dissipates. So memories become strong because of the emotions associated with it. It does not become strong by itself as a memory. So quarantining the memory would mean allowing the energy and the emotion to be released from the memory, and the memory gets quarantined. And after that, the memory remains as an innocent memory, which you can recall. I was in hospital. You know how they looked? My God, in the ventilator, they looked like ghosts. They looked like Star Wars. The guys in the movie Star Wars, they looked like aliens. And there's no fear, and there's no pain, there's no sadness. But then after some time, it did not go away. Then I told him, remember, all memories cannot be resolved. Some memories need to be dissolved. And the FDA had approved amitriptyline and sertraline for such patients. And he said, you may have to take a small dose of medicine. To give doctors medicine for anything in the mind is the Herculean task. My God, these doctors are really a pain in the neck sometimes, but somehow I convinced him. I did all my jugaad and I said, take it. And in the next 4 weeks, he was all right. So those who have pain, those who have enough scratching, burning here, burning there, can't sleep. A lot of patients, Dr. Armida, Dr. Richard, Dr. Cheryl and others, have depressive symptoms and they talk about death and dying. I met a BST officer, and this is just an example of a large number of cases, who said, what is the point in living? I think I've done my duty. And then these elderly people said, well, I've done my duty. My son is in Australia. My daughter is in the United States of America. Now I don't need to live. That would not be, it's an existential sentence. It could be depression. And he said, I don't sleep at all. Intractable insomnia is a very dangerous symptom. Treat them at the earliest. And that I think is very, very, very important. As I say this, let's look at the family again. I'm a man which helps people in solving simple things in a very simple way. So let's look at the family. Now, in this family, there were elderly people. I also live in a family where I have 2 elderly people. And you know what? We young guys want to protect the elderly people by saying, nothing is wrong. There's no COVID. You don't think I'm there for you. Just relax. You just do your exercise. You just eat. You read the Bible and just fast at Lent and don't do anything. I'm there for you. I am there for you. And these old people said, who the hell wants to know whether you are there for me? You tell me what the hell is happening around the world. When I see TV, when I see the newspaper, there's something else. And you're saying, I'm there for you. This Maihuna, that does not work all the time. It does not work all the time. So suddenly that elderly guy picked up the internet and checked my number and called me up and said, Dr. Shetty, they're all saying nothing is wrong. Tell me what is happening around the world. And I was a little surprised because I did not know what to say. I did not know the context of the question. So I said, can you please give it to your daughter-in-law or your son or your son-in-law and your daughter? And they said, Dr. Shetty, we don't want to give them any tension. We want to leave them alone. We want them to be peaceful. You know, they have taken care of us and we want them to be peaceful. So we don't want to do anything for them. We want to do everything for them, but we don't want to expose them to the news of the virus. I said, wrong. 1,200 grams of brain, which God has given us. God is very secular. He's given everybody the same brain, maybe with little differences in some of the Gaira and the Salkai. So there's some people are linguists, some people are scientists, some people are poets. But they have given a brain which asks questions. And what happened was, I told that fellow in the house, I'm using the word fellow in a very, very, in a very angry, condescending manner, mildly condescending, not very condescending. My dear Puta, tell your father, mother, or your in-laws the truth. Truth always has a little pain, but it settles down with a lot of peace. Truth causes turmoil, but it settles down and you get peace. But if you lie, it causes more turmoil and creates a lot of hassle. So what should I say? Say, you tell her that you tell them the fact. The fact is there is a virus we don't know much about. But one thing is, we have 3 vaccines in us: mask, vaccine, and distance. And if you do that, and don't tell them if you're comorbid, you're in trouble. Well, tell them if you take your precautions, take your medicines, you'll be all safe. And you know what? You need to tell us something about yourself. We need to talk. And then they started saying, I mean, this is what it is. And then these old guys started asking questions. And this guy got, again, Dr. Shetty, I told him, you said, I tell him everything I told him, and now he's asking questions. When you share an information, there'll always be questioning, and answer as many questions as you can. And if you don't know the answer, tell them, I'll come back to you. And these old guys were settled. Again, that man called up, no, these guys want the food in time. I told them to go to my brother's house because we are 3 brothers. They can take turns. I said, no, old people, when they settle in one house, they settle in one loo, one bathroom, but they can't change. And there will be quirks. There'll be some eccentricity. That's why they're old. And there you are tomorrow. You are there yesterday. You'll also reach there. And you'll also find that your sons need to be tolerant to you. So my dear friends, see that the elderly take medicines. They're not exposed to too much TV. But again, stories. But there was one man who said, my father is very stoic. He's always been stoic. Born immediately after independence, never shares emotions. And I do not know what to share. And I'm also stoic. I also don't share. And I told them, it's not their fault, Puta. It's not their fault. People were born before independence and after independence had to really settle down. They had to jhanda gaadne ke liye unko waqt chahiye tha. Jhanda gaada, and they had to settle down in a city, make the house, make a living. So they locked their emotions, they blocked their emotions, and they became stoic. That was a defense mechanism for them. But the next generation, that is you got all what they made, little, and you increased it, and you started sharing your feelings. But you never said, Mama, I love you. But your kids, if they don't come and give you a peck now, their grandkids, then you feel very uncomfortable. Why? Because sharing feelings took a generation after independence. So what should I do? He said, he's stoic, I'm stoic. If we are having tea, we don't talk to each other. What to do around COVID time? I said, Himmat kar yaar, himmat kar. तेरे 76-year-old बापू को जाके एक जादू की झप्पी दे. वो बोला वो फेंट हो जाएगा. हाँ, फेंट होने दे. फेंट होने के बाद उठेगा वो और बोलेगा तूने क्या किया? Hugging your loved ones is the most important activity in all these young wives and young husbands. Even if you had a fight throughout the day, hugging dissolves the COVID fear. And when they say, you have not hugged me for the last 10 years, why? Suddenly you have started after attending Dr. Armida Fernandez's lecture. Don't give my name. They will not hassle her. They might hassle me. What has happened to you? Have you gone mad? Tell them. I still remember this 84-year-old lady who told me, who had come to my workshop, and she said, and everybody was watching her. And she said, I know why you're watching. आज तक मैंने जिंदगी ऐसे वैसे जिया है, आज से अच्छे से जीना है. So tell her, yeah, what we have not done the last 15 years every day, let me start today. No, but you fought, no? Fighting, no problem. Cuddling important. Even if you fight, cuddle. 5 minutes cuddling. Oh, now your husband will get hassled. Just if you go and start cuddling your husband now, he might get a shock of his life. He might faint. Tell him. Feeling the breath of each other on each other's face is one of the most powerful anxiolytics on the earth. Richard will do it just immediately after the session. 100%. Richard he must have gone away to do it actually. So my dear friends, the stoic father and the stoic child. And the stoicism is not genetic always. It's also because of learning. Nurture, not nature. It's nurture. And I'll tell you what happened. A lot of fears dissolve when there is connectivity. Ultimately, what has Corona taught us? Corona has taught us that countries need to unite. The United States of America can't hold on their vaccines. They need to give it to others. 25% of the rich nations are vaccinating much more frequently and have cornered the vaccines as compared to the poor nation. No, if you have not yet learned the lessons of Corona. What is important is connecting. And research has shown that safety and a social network helps you to fight Corona much faster, much better than anybody else. And isn't that beautiful? Isn't it so simple? Isn't it free of cost? You need to have a workshop for that. Let's have a workshop of all of you hugging your pet. Come on now, Richard, hug your father. Come on now, Dr. Shetty. No, you don't need that. Oh, he may not have given his property to you. He may have given it to his daughter. So what? The earth is the owner of the entire property on this planet. We only have Satbara Uttara in your name. That's all temporary. The ownership of all your properties is Mother Earth. So start doing that, my dear families. Don't look at your father because he gave his property to his son or his daughter. Well, he has done it. Who cares? But ye tera bapu hai yaar. Vincent, to bapu hai kya nahi wo? And that I think is very important. As I say this, let me go to a step further because I have 10 more minutes to share. I still remember that there are certain beautiful technologies on the earth which helps us to bring the sympathetic and the parasympathetic nervous system back to normal. Armida knows it. Getting the sympathetic and the parasympathetic in balance, all doctors, you understand, brings back the immunity back to normal. Vincent has gone to hug his wife. Back to normal. And what is it that it is? What is it that is? Ultimately, life is the sympathetic and the parasympathetic. Guys, come back. You go, no. You hug and come, no worry. It's the sympathetic and the parasympathetic which is very important. So let me tell you, the biggest mental health professionals on this earth, the two biggest mental health professionals on earth were only Patanjali and Gautam Buddha. One invented yoga and the other invented mindfulness, that is Vipassana, which all Jesuit priests go and do as part of the theology. And mindfulness is Vipassana. Vipassana is free, but mindfulness is patented by the West and sold by the West. Which means what? Now I have to tell you something which will hit you hard. Because if I say yoga is cool, you will not believe this. But if I say the United States Navy has recommended yoga to all the sailors on the warships, I am not saying it. POTUS has said it. President of the most powerful country, they've asked all the sailors in their ships to actually practice yoga. You think Americans are foolish? Americans are the wisest. They know how to blend the orchestra, get the best from the world and use it for their own benefit. Which means what? Which means after your family prayers, whatever, Naukar, Mantra, Gayatri, or the Bible, or the Guru Granth Sahib, whenever you do it, very important. Prayer does not bring God on earth. Prayer actually gets the mind focused and makes you concentrate. Spend 10 minutes of family yoga. 10 minutes, not chatai love. No, 10 minutes. And do breath exercise for 10 minutes together. It creates energy. And there was a family whose father was IIM. He said, no, where's the evidence? Unless I see evidence, guys who live in the brain all the time can't emote. Guys who live in the brain all the time can't heal. Guys who live in the brain all the time can't touch people, can't touch hearts. So this guy started acting funny. Wife said, this guy is acting funny. What should I do? I said, give him the phone. I'll try. I said, I'll try. I don't succeed every time, but I'll try. And I told him, he said, I'm IIM. Inside the mind, I said, who the hell cares? Huh? I didn't say that to him. It doesn't matter. Yeah. Corona, I said, everybody's equal. So IIM, I मैं तेरे को infect नहीं करेगा, तुझे बाजू में हट जा. बाजू में हट जा. वो हाँ, that milkman will infect. ऐसा बोला है क्या कोरोना ने? नहीं, ऐसा नहीं बोला है वो. Then I told him, doctor, he's a PhD. There's an amygdaloid body in the brain. All the doctors know what is amygdala is the part of the body which helped us during the Stone Age. Fight and flight. In danger, the amygdala responses to danger and acts. But after that, we started becoming farmers. When we settled down, our brain also got the prefrontal cortex, which helps us to discriminate whether I should shout at Richard or whether I should leave him. So I told him, amygdala, it calms down. Your anger episodes will go down. And actually, your emotional hijacking, I use those big words, emotional hijacking will not happen. Then I said, hippocampus, your hippocampus really is the center for memory and intelligence, and it will absolutely help you to absorb all what you read. And actually, your prefrontal cortex will work so well that your ability to take decisions will be fine. And lastly, my dear friend, your heart and all other organs will work as an orchestra, not as a jugalbandi. And then only you live a fruitful life, you live a better life. And when people do your breathing exercise together, it has an energy, it has an impact. It's a very powerful impact. And Harvard said at the beginning of the disaster, beginning of the pandemic, that yoga is one thing which will help your immunity. Khallas kar diya usko. Because you need to use different arrows with different people. Armida knows it in her work, what to tell whom, so that they agree with her scientific approach towards helping the poor. So my dear friends, mental health science is not rocket science. Either you have sprain of the mind, fracture of the mind. Sprain of the mind means I failed in exams, I copied in exams, still they failed me. What to do? When you hug your child, you hug your friend, go for a short holiday and go here and there, and you feel much better. Fracture, you do everything, nothing happens. The mind is like a stone. It's paralyzed. It's completely like a stone. You give Switzerland or Saint Dharavit, it is the same. And then you need a psychiatrist or a psychologist. And that's what you need to do. My dear friends, lastly, I need some time for question answers, and that's the most beautiful part of the entire conversation. Lastly, my dear friends, get all your elders vaccinated. I got, my mother was 84, my mother-in-law was 78, my friend's mother was 88, all got vaccinated. Trust the vaccine. I agree with you, they're all in the experimental stage. 1 year, in 1 year, you can't make a vaccine. It takes, mums took at least 4 years. We don't have the AIDS vaccine even today. But in life, no, it's all about the best available. You marry the best available husband at that point of time. You can't upgrade him later. You choose the best available employee for your NGO, Armida, isn't it? The best available employee. So life is all about the best available. You choose the best available prime minister at that point of time. So life is all about the best available. The vaccine, it's the best available, whatever you have. And so see that your elders are vaccinated. See that you all do not run to Maldives and Mahabaleshwar saying going far away, you'll not get any virus. People said we'll go close to the Himalayas. Uttarakhand mein jayega to kisko nahi aayega. Now all guys who go to Uttarakhand are bringing back the virus. And now the latest is they want to go to the foots of the Himalayas. My God, you will go to the foots of the Himalayas and you will infect the Himalayas. So yeah, remember the word town, TOWN. Travel only when necessary, not because you are not because you don't want to. Sometimes we have to tie ourselves down. As the Jawans live in the bunkers for years during a war and live away from the families, why can't we live away from the virus for a short time? Why do we have to say, I can't live without a party, I can't live without traveling? What the hell, yeah? And all those young boys and girls who are listening to the show and who may not be here in the show, but show them this video at Ortho TV. I'm really grateful to Dr. Ashok Shah. Show them and tell them that if you want to kill your grandparents, go out and have a party. We need you to sacrifice. We need you to understand to stay inside the home, not because of you, because you guys may have a bigger thymus and you might save your lives. You would get an infection which is asymptomatic and you would not know, but you have the potential to be a human bomb, a human suicide bomb where you don't die, but you might send your parents and your elders to the hospital. With this, I stop. I am really grateful to this health initiative by the Archdiocese of Bombay, and I am ready to help you in my capacity, in whatever capacity I can, all the time, because I'm so touched by the fact, Richard, that you said you have to reach to the poorest of the poor. And remember, the poor are invisible in a globalized world. The poor are invisible in an industrialized world. They don't have a space either in front of the camera, in the front page of a newspaper, or in the hearts of a large number of people who decide our policies. All of you, please spread this message. There'll be a third wave also. There may be a fourth wave, chinna way, because as Corona goes, it says bye bye, acha to hum chalte hain, and they do it from far. But Corona is going to become a flu virus. It's going to stay, and we are going to develop immunity because God is the champion. The biggest pharmaceutical company is inside our body, and if you do not play with it, it will fight the virus. And if you play with it, it will really allow the virus to invade. With this, I wish you belated happy Easter. I wish you all the peace and all the joys, and let's all join together. I wrote a letter to the Prime Minister that let all the parties come together and talk about masks. I was shocked to see politicians and people in gatherings not wearing masks at all, not allowed at all, not allowed at all. I really appeal to each one of you, our Reverend Bishop and all the priests in the Archdiocese to talk about masks before the sermon and talk about masks as you end and see that we're all safe. We'll survive this pandemic. The human race has survived many more pandemics. Let's not waste this pandemic. Let's create this. Let's take this as an opportunity to build our resilience. With this, thank you.
Thank you so much, Dr. Harish, for that such an enlightening session. I'm sure it's been a Sunday morning well spent to learn so much about this relevant topic. Thank you for your inimitable style. It's not just the theoretical points, but your own practical pointers of that Jadu Ki Jappi and, very, very simple practical points, quarantining the mind. Wonderful. We have around less than 150 people watching, around over 100 watching YouTube. So we have time for a few questions. We won't take too many, but if anyone has anything specific to ask Dr. Harish, before we move on, you can press the raise your hand button and we will take your question. Anybody in this forum has, if you're on YouTube, you can post your questions in the comment section and we'll take it up. If you're on Zoom, you can raise your hand and we'll take your questions. Unmute yourself and you can ask your question. Okay, so I don't think there are too many questions. Dr. Harish, you've been very clear and in your delivery of I think Bishop has a question. Bishop yeah. Alvin?
You know, as religious leaders, we have this, I think, issue and problem that you would like to come back to our original functioning. We want our masses, the prayer services in the church. And sometimes we get, people get upset because they are not allowed to come to the church and follow certain religious practices. Because this is my reflection. Don't you think that now we have to think of a new way of religion? Think of a new way of religious practices. I was just talking to someone and I said, you would all like to come to church. Why don't you make your home a church now? It can be completely different. No, you want to receive communion. Okay. But make your, as you were saying, let your family, do that exercise together. Why have you to come to church? You can make the home. So maybe we'll have to think of new ways, and otherwise we think of the past and now all these things are gone away and now we can't do anything.
I completely agree with you. And this is the first disaster where scientists have taken charge. I remember working in Latur, Kandla, and many other disasters where they would always say, Upar wale ki ichha hai, upar wale ki marji, it's all God's wish. And here for the first time, religious leaders like the bishops, the Hindu priests have agreed and said that this is a phenomenon of science and we need to really look at something. Having said this, Fatalism was is the most important defense mechanism in India, at least. अपने हाथ में कुछ नहीं है, virus आएगा तो आएगा, ऊपर वाले के हाथ. For the first time, we said that this is not fatal. And here I would want to give you an example of what happened in the 30s in India and Bihar. Bihar had an earthquake. And Mahatma Gandhi said it's because of the atrocities of the upper caste and the lower caste. And who could tell anything to Mahatma Gandhi? I mean, nobody had the guts. But Rabindranath Tagore said, my dear Mahatma, that beautiful conversation you should read is there on the net. My dear Mr. Gandhi, let us look at a disaster with the prism of science. And so I think all religious leaders and the Catholic Church has been in the foremost, because in Mangalore also, where I belong to Belmont, and we have a church, Belmont Church, and I had gone to Belmont in the middle of the pandemic, and they had such a beautiful arrangement. 50 people can come in turns, and they're numbered, and a lot of safe distancing. And I think you all have done well. I agree with you, Honorable Bishop Alvin, that this is the time when addresses of schools are being pasted outside the homes, where teachers teach from homes, and homes have become prayer rooms, schools, offices. And for the first time, distance should not actually cause any issues. And if God, and if you can discover God inside your families, and your family is also a church, I think that's so beautiful. But I having said this, lastly, all those papa figures on the earth, politicians, social workers, community leaders, priests, have a big responsibility. An IAS officer cannot influence people to wear masks on the TV. He's so dry because protocols have no emotion. SMSs have their words, they have no emotion. If priests across all borders, across all religions, in a very charismatic manner, you have charismatic priests also, or in their own style, really push this into the minds of children, that safety is in your hands, rest is in the hands of God. I think that is something which is so important, Reverend Bishop, and I'm sure you guys are doing it. And I really ask everybody, Armida, who has a tremendous influence, doctors here, Dr. Cheryl, and everybody else, Giselle, your sphere of influence, that you need to tell people safety. Virus is very smart, but still safety, something we need to preach to each one of us. And I'm sure Father Alvin, Bishop Alvin, because I knew him as Father Alvin when by the way, we have talked to each other on the phone also, if you remember.
Yeah. There was a case.
Yes. Yeah. So I would say that all of us are Corona warriors. All of us. It's not the health guys inside the hospital or Corona. Each one of us have to battle Corona. So we need to do a bit completely in complete agreement with you, Father Alvin, Bishop Alvin.
Dr. Harish, there's a specific question from Vilma Fernandez, who says that there have been deaths caused due to vaccine. Do you have any comments about this rising fear about this vaccine being dangerous because of the deaths which have been accounted for?
They have been investigated, and there's some evidence to say clots have formed, but contraceptive pills form more clots than the vaccine. That's the first. People have died half an hour after the vaccine, 1 hour after the vaccine. They all had comorbid illness, including people have died in Norway, where they had taken the Pfizer vaccine. Honestly, I would say that the evidence which is there overall, though there are certain restrictions to vaccine in Scandinavian countries, also in some European countries, all the data is not available. Vaccine does not cause COVID. But what happened in Bombay, at least, the number of people in the vaccination centers was so huge at that time. That could have been a place where virus could have caused. And people who have got the infection just before the vaccination were more prone to mortality and death also. What we have found is post-vaccines who have got COVID, the intensity of COVID has been small. The intensity of the COVID has been small. And I have no evidence of any mortality of of the virus after COVID. And as somebody said, the COVID vaccine is not like a polio vaccine. It's not a bulletproof proof jacket. But I would say that if you have comorbidity, if you have allergies, if you have a history of anaphylaxis, what you need to do is you need to go to your doctor, find whether the vaccine is safe for you, and then choose the vaccine. So you need to take a very guarded decision, very, very well thought of decision with your allergy doctors, with your heart doctors, and then go and take the vaccine. But in my opinion, say for example, my friend died after eight days of the vaccine. Now, he had hypertrophy of the heart, which very few people knew, and he collapsed after 8 days. So 8 days after the vaccine, if you collapse, it's not because of the vaccine, but still, I'll tell you, my dear friends, as of now, the evidence points to the fact that vaccines are safe. But 10 years from now, when we look back, as Dr. Armida and other doctors know, retrospective understanding of what was COVID, what did the vaccine do, we will only know after 10 years. But as of now, I can say a blanket statement. If you have any comorbidities, take the advice of your doctor, then go and take a vaccine. But on the whole, vaccines are safe. I took the vaccine the first day for sure. First day for sure I took. And I took the second vaccine after 8 weeks. And my family, 84, 78, 78, I've vaccinated all of them. So that's where we stand.
Dr. Harish, there's a question from Mary Alfred, who says, given the circumstances, she suffers from panic attacks. She's asking, how does one cope up with a panic attack when you're traveling alone? When you're alone, how do you manage a panic attack?
Yeah, absolutely. If you have a panic attack, if your treatment strategies have been yoga, if it is small dose of medicines, you're already on treatment. First of all, through a lot of breathing exercise, calm down your sympathetic nervous system. The little of cognitive exercises where you can tell yourself the panic attack is the brain playing fun of the heart. Brain is teasing your heart, and you believe that there's some sense of impending doom. You might drop dead. And if you have done those exercises in the past, and the third most important thing is, if you have seen the film, The Beautiful Mind, the analogy is a little different and the metaphor is a little different. Towards the end of the movie, he gets hallucinations and he looks behind, but he ignores those hallucinations and goes ahead. Similarly, you might actually allow the heart to beat, and in 10 minutes it slowly settles down. Or you might use a lot of distractions and it will slowly settle down. If you're traveling alone to a market, then you should use exposure with desensitization. Travel 10 yards for 7 days, 20 yards for 7 days, 30 yards. Till you're comfortable to travel 100 yards and go to a shop, wait for 5 minutes, come back. And if the heart is little, if the chest is a little uncomfortable, just allow it to be. Let the automatic thoughts come and go. The automatic sensations come and go. The automatic feelings come and go. It will be better. Lastly, if your doctor has given you an anti-panic pill, which you can put in your mouth, if you're traveling by flight, just before boarding, just the night before, sleep well with anti-panic drug. As you're flying, you might take a small dose as you travel, a small dose when you board, and just sleep across the flight. And once you make a successful flight, your faith in having those flights again will come back. So more you encounter the panic, more you encounter the world, the panic attack goes down. If there's any event which is the cause for panic attack, like being locked in the house as a child, like being beaten up as a child, like being involved in an accident as a child, having a very traumatic memory of a childhood, or even if you have had child sexual abuse, you can treat it today and really get your panic attack solved.
Dr. Christy Jahu is asking, I think she is alluding to your comment saying there'll be a wave 3 and a wave 4 and a wave 5. That Tata bye-bye, I think you mentioned. She said, will our lives ever return to normal after Corona? And how soon do you think, in your opinion?
You know what? There's a Greek saying, you can't step into the same river twice. And people come and say, I'm not like the way I was before. Huh? I'm not like the way. I tell them, just look at your album photo. Are you the same? Your marriage album photo, your photo when you just passed your MD, you're not the same. You're different. Your hairs have grown. Your energy is not as much. You can't do all those things which you did at the age of 20. So there is nothing like normal anytime on this earth. There's always new normal. In Hong Kong and China, they're used to wearing masks for a long time. For a long time, the Jain Munis wear a mask all the time. So there's nothing like Pahle jaisa hoega kya. Arey yaar, you can't step into the same river twice. The water is different. These couples try to go for a second honeymoon to live the first honeymoon. It doesn't happen. The second honeymoon is different. The first honeymoon was different. So it's all different. So it's always new normal, new normal, new normal all the time, whether you have virus or not. I think that is the philosophy of life. That is the philosophy which we need to accept and absorb.
Dr. Praveen has a question. I'm scared to start my own medical practice, but how to overcome fear? It was my dream.
Oh, yes. If you're, unfortunately, all of us in Bombay and other places have very small clinics. And if you're a general practitioner, then you need to do a lot of online work as much as you can. And if you can, actually, I'm asking doctors to do group practice. They can buy a bigger place, sell out their old places, and have a much bigger place, and all four of them can practice in the same place. Corona has asked us to work in teams, no? And you can, like in USA, they all work as groups and they can always take their holidays as freely as they can. And that is one way. Secondly, use a lot of online practice and see patients, of those who you have to see for sure, and see that you have got vaccine. Unfortunately, a lot of health workers in Maharashtra have not got even vaccinated. A lot of elderly people have yet not got vaccinated. So this is what you can do, sir, within your limits. And some of those young doctors have bought houses and clinics over EMIs, over EMIs, and that's a big issue. I mean, you need to pay them, and bankers are bankers. They're like the old money lenders. In spite of the government's advice, they'll come at you all the time. Keep talking to your banks and say payable when able. And I'm not seeing a doctor defaulting on a bank payment unless he has bought big machinery. Those guys who buy big machines, they might default. But aaj nahi to kal wapas denge, and start with little and use all the safety protocols. And if you remain at home all the time and not practice, you'll be in trouble. Remember, I have never stopped my practice across both the waves. I go live to my clinic, but fortunately, I have a bigger clinic. My patients are at least 12 feet away, 10 feet away. I use all the precautions, and though I'm not as young as you think you are, I've been practicing because if I practice, I find meaning in life. They say, why are you practicing? I said, one of the best antidotes for COVID is finding meaning in life. And you find meaning in life, and it also improves your mental health. And if they all say, why are you doing so many lectures? I think I do lectures just to improve my mental health. Huh? It's not for you guys. It helps me find meaning in life, and it really helped me to be where I am. So that's how it is.
Dr. Harish, we would love to go on, but I know you have a session after this, and we'll have
No. I don't have. For yours, I recorded the session at 12 o'clock.
Oh, wonderful, wonderful.
Yeah. I did not.
So we can take a couple of more questions.
Yeah, of course. Any more. I'm there for you.
So someone, Neil Roy is asking that she has peripheral neuropathy due to COVID after effects. And she wants to know what the treatment for that is.
I really don't know what's the treatment for that, but what you need to do, there are many complications. There's Guillain-Barré syndrome, which has been reported by my neurologist, she has sent a paper and it's being published. They saw 14 cases of Guillain-Barré syndrome. Some of them have found cases of peripheral neuropathy. It may not be. See, a lot of people have burning sensation, very common. And a lot of pregabalin has been given. It didn't work. Richard, it didn't work. Huh? And just give a small dose of amitriptyline, it worked. Small dose of amitriptyline. So I would ask my friend to go back to his doctor and ask him if it's a wise idea to really give a small dose of amitriptyline for that burning sensation, which may be peripheral neuropathy or not peripheral neuropathy, and that might actually work. At the same time, do whatever you have to if there is some visible evidence-based damage to your nerves. But a lot of guys who have burning sensation, who believe they've got peripheral neuropathy, do well with small dose of amitriptyline. In the elderly, be careful. Do an ECG to see that you don't have a QTC abnormality, and that works.
There's an interesting question which says that we are told by everyone not to go into crowded places, don't visit the market, and all these things. But this person says that there is a phobia to go to a vaccination center itself. Because that itself is a hotspot of people all around you and who are sick. So how do you cope up with that fear?
I see a lot of discipline in some vaccination centers, and one of them is the hospital Seven Hills in Bombay. Hirandani Hospital also very disciplined, where the CEO himself is there down helping every patient, very disciplined. I'm not saying because I work there. And there are many other hospitals where there's a lot of discipline which is practiced. So choose that hospital and go and it's and all of you, so some of you who are scared of those centers are actually scared of the vaccine. And so so the best time to go is early morning first, and the best time to go is on weekdays and on public holidays. It's empty. And if you're elderly, and if you're on a wheelchair, and in USA they have started homebound elderly vaccination at home. In many states in the USA they have started. Here we have not yet started. Though Iqbal Chal said we will not leave any person unvaccinated. If you have a wheelchair, etc., please go and request the center one day before. Let me tell you, the vaccination centers in Bombay have been very kind, very largely very well managed, very warm, lot of water. In 7 years, they would also give snacks at some point of time. The security guard also talked to you so nicely. From the security to the person vaccinated, the nurse vaccinated, it has been a phenomenal experience. So look at all the variables and see that you follow all the guidelines. And if there's something on a wheelchair, please tell them that please take us as soon as we come, and they would generally oblige. I'm very happy with MCGM with respect to the vaccination. Absolutely, I don't underestimate a hospital. The best doctors are in Sion, Nair, and KM and JJ. Don't run to private hospitals all the time. They have more facilities. They have MD, DNB doctors, and please understand that they can give you the best of treatment. I was born, Richard. I was born at Nair Hospital. My both siblings were born at Nair Hospital. My father was operated in Nair Hospital. So I believe that if you really tap the hospital, they'll give you the best treatment.
Great. Cyprian Almeida, go ahead with your question. You raised your hand. Cyprian, are you there?
Yeah.
Go ahead, ask your question.
Yeah. Doc, I would like to know which vaccine is safe. There have been a lot of talk about this vaccine being good and that vaccine being good. According to you, what would you recommend?
Cyprian, as of now, all the vaccines are in experimental stages, and you have no choice of the vaccine. By the way, you have to take the vaccine what you get. Most of the places have Covishield, but Godrej and JJ had Covaxin. And the best thing to do, Cyprian, is to really talk to your doctor and find out if you have any serious comorbidities. If you have serious comorbidities, and then the experts say that Covaxin would be a little better, but you have no choice. You have to take the vaccine which you have. But if you look at the evidence, and the first evidence is we don't know. We need evidence across time, no, Varmida? The first papers are those are like the bridegroom on the first day. She looks nice. The bride also looks nice. So once they start staying, you know how good they are. So Pfizer has 91% efficacy. Moderna vaccine also has got very high efficacy. Johnson & Johnson is going to come with the one-stick vaccine. Then there's a nasal vaccine. So the second generation vaccines would be much better than the first generation. As of now, you take what you get. But if you have any issues in your body, you should take the advice of your doctor.
There's a question from doctor. I was just thinking, is there so much uncertainty in life, much more than before? It's difficult to cope with this unpredictability. How do we deal with this? Any tips or tricks to deal with this? Dr. Agarwal has asked this question.
Yes, Dr. Agarwal. So when I spoke to young boys and girls from the HR college yesterday after the 12th, I said, you know what, you have been topper in the 10th standard and you want to top in the 12th standard, but some things might go wrong and your aspirations might be hit. But remember, as somebody said in a beautiful English movie, protect your dream preserve your dream, postpone your dream, because we are at a pause button in life, a pause button. Abhi sab ruka hua hai, ruka hua faisla hai. Live life in a peaceful mode, keep your head above the water, bide your time. The pitch is turning a lot. Don't try to hit the ball outside the off stump on the leg side. Preserve your wicket. Preserve your wicket. And when the sun shines and the ball stops turning and swinging, hit the ball for a 6 or a 4. So do not change your style like Sachin changed his style to different bowlers and at different age groups. And do not convert your sadness into pity and sympathy. That's a very dangerous phenomenon. I'm sad. It's by me. I mean, in my lifetime only this has happened. In my mother's lifetime, it has not happened. My father was a doctor. It didn't happen. Cut all that crap and say that let us preserve our dream, protect our dream, postpone our dream, and if necessary, change your dream. If a boy says, I had to go to US for undergraduate education, go for your postgraduate, do your undergraduate here. If somebody says, I had to go to Ashoka University to study, and my father is not very keen for me to send any, after weighing all the pros and cons, my father said, you should do your undergraduate here, then go fly for your postgraduate. So inhibit your wings, fly at a lower height above the earth. And when you can fly high, use your wings. So thoda pause button hai Agarwal sahab, Dr. Agarwal. Thanks for that beautiful question. Abhi jitna practice ho sakte प्यार से करेंगे. दूर का patient को दूर के doctor के पास हम refer करेंगे. I had a call from Borivali in the morning. He's violent. So I said, he can't come here, too far. I sent him to other doctors. This is the time Corona is saying, work as a team, be as a team, let countries come together, communities come together, families come together. Families who have not talked to each other for years, let them come together and believe that you need to push your dreams a little farther. There is no uncertainty. Life keeps on changing. Small uncertainties happen all the time. This is an uncertainty for Mother Earth. So we're all in the same boat. और अंधेरे के बाद सूरज उगता है and there's a beautiful song of Devanand, फिक्र को उड़ाता चला गया, without the cigarette, by the way, without the cigarette, he smokes a cigarette there, without the cigarette. So never waste a disaster. Use it as an opportunity to improve your resilience, get back into your family, read a lot, publish a lot if you like, give lectures. And if you have financial problems, instead of pamphlet, let's have mandili and and minimalism. And one thing Armida of minimalism, Armida would remember. Richard is younger, and Ruin also would remember. You remember the days when there was no rice in Mumbai, black marketing of rice?
Yes, of course.
And we ate lapsi. Do you remember that?
Yes.
Yeah, Armida, you remember? No, this Chisel and all were born much later.
When we were not allowed to have any, dinners and all for weddings, we had our wedding with no snacks at all.
Absolutely.
We were lucky, of course, we didn't have to spend, but for those who wanted to, there were times where you couldn't serve anything during functions.
Yeah.
We have had tough times.
Father Alvin would also remember. Bishop Paul would remember. So
I remember, yeah.
Those days, my dear friends who are listening, our mothers were happy eating all that lapsi. So there was joy in minimalism. But now what's happening to the mother? I can't give my daughter the burger. I cannot buy the pizza more, so I can't. I'm really causing pain to my daughter. If mothers cry when there is minimalism, you will destroy the confidence of your daughters and your sons. Enjoy the minimalism. If you can't eat 2 vegetables because of financial issues, have 1. If you can't pay all your loans, tell them payable and able, interest I can't pay. If you have lost a job, remember, shout out loud and say, I need a job, kill shame and seek help. Don't hide in your cocoon. And then you'll preserve your mental health, because ultimately, anything can happen to anybody. Visiting cards, addresses can change, and names can also change. So it's so important for you to actually accept the situation and move ahead. It may not be applicable to Dr. Agarwal. I'm just giving it an answer to everybody.
Dr. Rohan has asked a question. A family friend lost her husband to COVID 6 months ago. Now she is positive. What emotions would she be going through and how to offer to help her?
Thank you, Rohin, for asking this very sensitive question. There are many range of emotions. One emotion which could be very detrimental is thank God I can meet my husband in heaven. So that is one emotion which can be very detrimental. Second emotion, something happens to me, who will take care of my kid? Number three, I am sure I will not live. My husband left and I also would leave. And she needs more emotional support if she's admitted in the ward. If she needs, probably, we need to be careful whether she's sleeping well, because if she would not sleep, the oxygen saturation goes down. Remember, immunity is all about the mind and the body. So see that she sleeps well. See that the nurses who are taking care of talks to her a little longer than all other patients. See that the doctors who take care of her give her a pat on the back with their COVID attire and see that they maintain her morale. See that a close members of the family who talk to her on the phone in the ward. If she's in the ward, if she's at home, don't talk rubbish. They don't talk. Remember, Indians don't know how to talk to people who are well. Tell them, we will see to it that your kids will get food. If you're in hospital, we will see to it that if you need any financial help, we'll support you. We'll see to it that you will come back home, and we're waiting for you to come back home. Or if you're at home, we're waiting for you to recover. Let the close family members offer. There are three supports, material supports, which people need when somebody is sick. One is, I'll send food to your family. Very important. Number two is, if you have less money, I'll pay money, or I'll be in touch with your doctor all the time and see how you really progress. Number three is, if there are shortage of medicines, of remdesivir, which is not easily available now, I'll move heaven and earth and I'll see that I get you medicine. And the fourth is, I'll have a kind word for you till you completely recover, and watch for depression. And if there's any depression, see that she's treated. I wish her very fast recovery, and she would be at high risk for her mood because she may not have healed from her husband's death, and also that probably this wound of COVID might open her wounds which are still unhealed. But be careful if she says, I'm happy that I got COVID, I'll go and meet my husband. So that's the answer for this. Thank you, Rohin, for asking such a sensitive question.
Dr. Harish, you still want to take a couple of questions, or we'll wrap up here?
No, you can ask. I'm ready. I recorded the show yesterday night.
There's a question which says, can people with metabolic syndrome take the vaccine? Yeah, and does ivermectin intake block the virus?
Well. I take ivermectin every week as a preventive drug. Initially, we took HCQ. And now, so there's no evidence. Then they say HCQ is useless. Ivermectin also, should not take ivermectin too much. The issue is that if you have metabolic syndrome, for whatever reason, the best person to advise you is your physician in consultation with a virologist. What I have seen is, because those who have metabolic disorders are more vulnerable to the virus, I have seen a large body of opinion which says that please take the vaccine unless you have any allergies, and see to it that you're immunized. But the best thing what this gentleman can do is to actually talk to his doctor and also the doctor at the vaccination center. Number two is that ivermectin, again, is an ILC inhibitor, and it's supposed to be good. But the combination of doxycycline and ivermectin is given to a large number of patients with very mild symptoms. And let me tell you, there are a lot of controversial information about all these medications. We will know once the hard body comes, even about Fabiflu. There are some who say that it's a placebo, but there are many who say that it works in the first 72 hours of the virus. So do what your doctor says. So even if you don't have hard evidence, whatever evidence is available as of now across the globe, our doctors will use, and that is what he or she should follow.
Okay, thank you.
There is one Mr. Daniel who's a question. My wife is a working woman, and now because of COVID, she's working from home. We both are working from home, and we are both irritable, fight more than before. And as you said, COVID has made us more irritable. How do we deal with this?
I know. Armida, in the first month, it was a honeymoon. Huh? They're all at home, all eating, playing board games, painting, and all these women would post a lot of baking cakes. And other women would get so inferior, felt so, I mean, they're baking, we're not baking, it was competition. After that, familiarity breeds contempt, no ma'am. I always tell surgeons not to marry anesthetists. Because right from the breakfast table to the table at dinner, they all would be together. I think there are 4 or 5 things you should do. Number 1 is that exercise. Now you will say that the gyms are closed. I need weights. I need bars. Well, Harish Shetty has invented an exercise inside the house. I walk 7,500. Earlier I used to walk to 10,000 feet every day. Up and down, 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 up and down. Exercise dissolves fears, tears, and anger. I'm not saying it. All of you have heard the name Black Dog. No, not the whiskey, not the whiskey. Ruin, don't smile. Black Dog is the term which Winston Churchill used for depression. My Black Dog is said. And the WHO has come up with a 4-minute movie on Black Dog. And that shows that exercise is an antidepressant. Irritability is anger in motion, isn't it? Anger is a normal emotion, is energy. Anger is energy. But irritability is anger in motion. Anger is positive, aggression is negative. So one is going up and down, up and down, up and down works. Number 2, Stanford said recently, sleep is important. If you don't sleep, you die early. So what happens when on the screen, there are 3 compromises they make. They don't know how far they should keep the screen. They don't sit erect. They sit on the bed and watch. When you slop on the bed, your back also suffers. Number 3, tell your boss that you need to have a napping time also in the afternoon. All those companies which give time to nap in the afternoon are doing much better. And what happens is this boss also have a strange mindset. घर पे बैठा है साला मजा करता होगा काम पे काम कराओ साले को जितना ज्यादा काम दो उतना अच्छा है. My son used to do that. My God. And also because they can't meet, they have explained to each other. So what is very important is take mini breaks. Micro pranayam is 5-minute pranayam sometimes. Just 5 minutes, 1 minute. Do not understand. It's not essential for you to have empty stomach to do pranayam. Diaphragm is strong enough to push the stomach down, no man, Richard. So 1 minute meditation, 5-minute meditation, a walk up and down, go down in the building with the mask and see the fresh air, look outside the window and see if you can see the sun either at 12 o'clock in the afternoon, or if you're lucky, you can see the sunrise or the sunset or whatever. Look at the birds going up and down. Get in touch with nature. Nature is an anxiolytic. I still remember when I used to work with schools at Jamshedpur, the schools of middle class and upper class guys had a lot of irritability and anger, but those tribal schools had no anger, peaceful. Why? They run on the grass, they climb trees, nothing, no anger, peaceful. So try and get in touch with nature. At the same time, sometimes bosses humiliate because they're all stressed. They insult you. They say, they give you a lot of deadlines, a lot of work. And so at some point of time, you can say, sir, this is what I can do. This is what I cannot do. Please understand. Don't be scared. Don't be scared. And also draw a line. At the same time, don't make your wife run around because she's at home. She's working at home. And all the wives, let me tell you, have a meeting in the morning on a Sunday morning. Tell that the world is changing. And I'm not a martyr, I'm a manager inside the house, as I was a manager in the family. And all of you sit down, let me allot you some tasks and give tasks to everybody. Also, the elderly people in the house should be given some work, otherwise they'll go mad. Little work, folding the towel, doing something. The little work also keeps the mind healthy. So give all the work, little work to everybody, and then see how it works. So delegate as much as you can and don't be available to everybody all the time. The martyr will collapse, the manager will survive. And then what happens is, these mothers are also dangerous. Indian mothers, they only talk. They still want to become the Superman. So what happens is, some mother-in-law says, this has not happened in my house ever in my life. And the girl says, this is Corona, this is new rules in new Corona times. And then when that happens, things change. But remember, there cannot be any change without turmoil. And again, these mothers, horrible girls, these mothers are. They want a perfect kitchen. When the husband tries something nice in the kitchen, there's all hassle. No, husbands don't know how to keep the kitchen clean. They say, hey, you come here and spoil my work, and you really increase my work in the kitchen. And again, they say, forget all the rules. Shetty comes and Shetty goes. They don't know how my house works. I'm not a manager. I again become the same old mother. My dear mothers, imperfect house, happy house. Imperfect kitchen, bonded family. Perfect house, unhappy house, because there's somebody who's suffering to keep it perfect. So, Dr. Cheryl, you know what to do today, no? Chisel, you too. So changing the paradigm in the house, as Armida will say, as a social scientist, changing the level of empowerment of different people, changing the power equations, as she would say in her words, is so important as of now. And I'll tell you what, these men, no, like Ruin and all, they'll feel very reluctant to go. Once they go into the kitchen is not the most romantic place in the house, by the way. Even if the chapati becomes burnt, even if the rice is overcooked, the joy of doing the work inside the kitchen and the joy of really sharing the work is something which is very important. So let the mother become a manager and not a martyr. And after the entire day is over, debriefing between the father and the mother. The guys who are working, debriefing means ala to kutra mala kiti kam gela sala to samjatas nahi त्याचं काय सांगायचं रे. Oh, my God, Habi, darling, this guy is a new HR manager. I don't know what the hell he's got in his mind. He's making us do document by document, protocol, this, that, what the dash. Father Alvin is there, Bishop Alvin is there. I don't want to use unparliamentary words. What the dash these guys are up to. And debriefing. It's also true for health workers, Richard. When health workers work in pairs, no, they're healthier. And when they come back in the evening and sit and have a cup of coffee and debrief each other, they're much more healthier. So these are the small things that you can do. But at the same time, exercise, breathing, diet, and no begums on Netflix. Huh? All husbands and wives, understand? Huh? I'm not a priest, huh? But I'm giving you directives. Huh? No Netflix and Amazon at night. All those dirty movies, please don't watch. If you sleep more, you'll be happier. Your husband will be happy in bed, and your wife will be happier in the kitchen. Sleep well. Stay away from Netflix. You can cheat once in a while, but don't compromise your sleep. Sleep deprivation is worse than insomnia. You'll die early. We don't want your month's mind early. So sleep enough. And in Corona, remember, this drink is bad, this drink is better. Glass of milk is better than yellow milk. Brings down immunity. Many guys will be very upset and angry, but I have emptied my fridge. I've not kept anything in my fridge.
On that note, Dr. Harish, on that wonderful note of manager versus martyr and keeping the ladies happy on that note, we'll end this session. It's nearing 12 o'clock. And before I invite our team member, Dr. Cheryl, to give the vote of thanks, just a few lines for our guest online about what this health outreach project is all about. As I was saying earlier, the health outreach project, we have a core team of around 6 dedicated doctors. Our senior most Dr. Cedric Moraes, Dr. Ruin Mascarenas, Dr. Giselle Pez, Dr. Cheryl D'Souza, and we have Mr. Florencio D'Souza. We all work with Dr. Armida Fernandez towards a singular vision of providing healthcare services to the poorest of poor and migrants. It's been a few months now. We have a panel of doctors who have consented to offer free teleguidance and assistance to all our patients. We even have a group of generous donors. And we have this network of affordable healthcare units that the poor can avail of. So we work with a committed coordinators at every church level who are our actual hands and feet in the project. So to all our guests, if you would like your parish to be part of this project in any way, or if you would like to just know more, do write into us at healthoutreach2020@gmail.com. I'll repeat that. It's all one word, healthoutreach2020@gmail.com, and we will get back to you. So with that, I will now hand over to Dr. Cheryl to conclude the session.
Good morning, everyone. I, Dr. Cheryl D'Souza, on behalf of our Archdiocese Health Outreach, would like to thank our fun, joyful, fearless, totally fearless, and very inspiring speaker, Dr. Harish Shetty, for giving us his Sunday morning to enlighten us with something as simple as doing nothing, which for me was very difficult. Never would we have thought learning the lessons of Corona would be so much fun. Thank you for removing the fear from our minds. Our families are going to be blessed and with a lot more hugging going around. At least my husband's going to be a lucky man today. We have learned to not just quarantine our bodies, but we will quarantine our memories, let it dissipate, and just get them dissolved. We are going to fight this virus without any fear. Thank you, Dr. Harish. Special thanks to our technical support, Dr. Ashok Sham, and the Ortho TV team. Without y'all, this event wouldn't be reached out to so many viewers. I am positive it's going to touch so many. I would like to express our gratitude to our dear, loving Bishop Alvin De Silva for believing in our team, for showering his blessings. Thank you for this initiative for making heaven a place on earth. A big thank you to Dr. Armida, our guiding force, our project head, her nature, her very big heart, and she's got two very, very big hands. Her hands are so big that they've reached out and she's given a little part of us to our little 6 hands that we work with her too. Thank you, Dr. Armida. Dr. Richard Pereira, our project coordinator, he's nothing but a genie in a bottle. Nothing is impossible for him. He believes in a greater force, our Almighty, our Abba Father, and no decision is made without prayer. Working with him has taught us prayer. He believes
He's
in
very gentle too, very, very gentle.
Yeah. He believes in that God. We believe in him totally. He has envisioned this project to reach great heights. And believe me, it's nothing less than a stairway to heaven. Our fantastic 5 team member, Dr. Cedric Moraes, Dr. Ruin Mascarenes, Florencio, Dr. Giselle Praise, and myself are all made earthly angels by the spirit that is flowing through this project. Thanks to all our heads and leaders above, and thanks to our Almighty God. We'd like to thank all our PVCs, our doctors who have given of their time and being part of this project of us, being part of our loving fraternity. Without you all, we wouldn't be able to reach out. Last but not the least, I would like to thank our wonderful audience for being so patient and being with us today. You all said, "Main hoon na," and that's why this was a success. Let's spread love everywhere we go, and let whoever comes in touch with us leave us much happier. I would like to end with what Dr. Harish Shetty has told us. Let's go tell stories and not glories, and together we will make heaven a place on earth. Thank you.
Thank you.